abnormalities there. There isn't. Can you lift up your tongue for me? Great. Okay. It looks like your teeth are all intact. I don't see any signs of decay, and it looks moist and no extra film on your tongue or anything. So if you want to stick out your tongue, and can you say, I want to gag you. You say ah. Ah. There you go. All right. So the uvula is midline, and I don't see any signs of inflammation with the tonsils. So, no, your tonsils haven't ever given you any grief?
Nope, not
Awesome.
so far.
Awesome. Okay, well that looks great. So we are going to be moving our way down. So I'm going to listen to your heart and your lungs, but I'll ask you a couple questions first. Any history of heart issues?
No.
Any family history of heart issues?
No.
No? Okay. Any episodes of dizziness or chest pain?
No.
No? Shortness of breath?
No.
You can exercise and keep up with your peers?
I can.
Awesome. Okay. Well, good. All right. No swelling in your ankles?
No.
No? Okay. What about smoking? Have you ever been a smoker?
No.
No? Awesome. What about vaping?
No.
Yay. Okay, good answer. You're probably not supposed to say that. But I'm happy you don't vape. Okay, any coughing up of any sputum?
No.
Any exposure to upper respiratory illness?
No.
No? Okay, great. Okay, want to listen to your heart and lungs. If I can have you expose your chest here a little bit.
Alrighty.
Yeah, thank you. Alrighty. So I'm going to listen to 4 spots on your chest with both sides of my stethoscope. One helps me hear certain sounds, and the other one helps me hear softer sounds like murmurs. So I'll listen with both. And so I'm going to listen for about 30 seconds on this side. So I'm going to like your second intercostal space, which is about here, and just right of the sternum. So I'm going to go about right here. And I'm going to listen for 30 sounds. I'm listening for a lub-dub sound with no extra sounds. And I'm not hearing any extra sounds. I'm also going to feel your wrist while I do this to make sure that the rate on your chest matches the rate on your wrist, which it does. So that's a good sign. Sorry. Yep, and that's equal, so that's reassuring. Then I'm going to listen. So that's called your aortic valve, and then over here is a valve called your pulmonic valve. So I'm going to listen over there for 30 seconds, and we might pretend for the videotaping it's 30 seconds if that's okay. Alrighty, and then we're going to listen for what's called the tricuspid valve, which is like your what we call your 4th intercostal space below your 4th rib, just left of your sternum, that bone right there. And this is where a valve is called your tricuspid valve. It's a valve between the top and the bottom of your right side of your heart. And that sounds great. I don't hear any extra sounds. So 30 seconds there, and then 30 seconds here, where I hear the bottom of the apex of the heart, actually. And I'm listening for the mitral valve. And that sounds nice and healthy and normal. And that's the midclavicular line, middle of your clavicle, 5th intercostal space. And I'm going to listen with the bell, the same locations for murmurs for 30 seconds each. 30 seconds. 30 seconds. 30 seconds. And then I have you roll over on your left side, if I may have you roll over on your left side, Tamsin.
Okay.
Just like that, yeah. Great. And I'm going to listen a little bit on the side here. And I'm going to listen with both. You can hear that part of your heart, when you turn on your side, it gets your heart kind of closer to your skin where I'm listening right here. And so if there is a worrisome sound, I'm more likely to hear it when you're on your left side. But I don't hear anything, it's great. And the loudest sound is where I'm expecting it to be too. So that's perfect, thank you.
You're welcome.
Now I'm going to listen to your lungs. So as I listen to your lungs, I have you take a
deep breath in and out, but I don't want you to, like go too fast on my account. Just go at a pace that's comfortable for you. I don't want you to get dizzy or, you know, anything like that. That one,
Okay.
not what I'm going for. Okay, so in and out through your mouth, nice and slow. Awesome. Big breath. Awesome. Big breath. Awesome. Big breath. Okay, and big breath. And big breath over here. Okay, that sounds good. I'm gonna listen to the back side of your lungs now. So same. And while I'm doing this, I'm kind of looking over his skin too. So I'm going to be just checking to see if he has it, you know, that he has equal chest expansion. I'm kind of taking note of the width of his body this way versus the width of his body that way, just in general. Go ahead and take a deep breath for me. Just, I'm kind of looking for equal expansion of his chest. So, okay, deep breath, please. Great. Again. Again. And again. I'm getting just inside the scapula for obvious reasons. Okay, big breath. Okay, and big breath. And some practitioners will go, this is kind of a basic exam, but sometimes we might go a little bit out here too, to check, but we check laterally from the front. So, great, thank you, Tamsin. We're kind of, as we're doing that, kind of looking in general at things. So, alrighty, so you can put your gown back on if you'd like, and I'll just have you pull it up to expose your belly so you're not cold. Alright, so you said you had some tenderness over here.
I did.
Alright, so we asked you about the pain. Your appetite, you said no difference in your appetite, did you say, or did I ask you that? Yeah, sorry, getting mixed up with one.
No difference. in
Okay,
my
no difference there, okay. And when did you last have a bowel movement?
Yesterday.
Okay, and would you describe it as soft and brown and formed, or differently than that?
The first answer, soft and
The
brown.
okay, good, okay, no blood,
No.
okay. And do you normally have a bowel movement every day?
Yes.
Okay, great. How about with your, since I'm gonna be checking your bladder as well, do you have any problems urinating?
No.
Any burning with urination?
No.
No, and the color of your urine is clear and yellow or pale yellow?
Yes.
Okay, great, okay. So I'm first gonna listen, and then when I'm done listening, then I'm gonna gently touch to see if I feel any masses or anything. So I'm gonna listen to all 4 quadrants. I'm gonna listen for about 30 seconds each quadrant. And I have to listen for a full 5 minutes to say there aren't bowel tones. So this is gonna be 30 seconds each quadrant. And I'm looking at his belly while I'm listening as well to see if I see any, if the skin color looks normal, if the perfusion looks good, if I see any heaving or masses. I might be looking to see if there's any varicosities, which can give us different pieces of information. So as I gently touch you, tell me if you're having any tenderness. And I can put this hand on top of this one, so this
Okay.
one's going to be my feeler, and this one's doing the pressure. Any tenderness at all?
No.
Okay, and I'm feeling for masses. Okay. Let me feel up here. Any tenderness at all?
No.
No. And tell me for real if you are, because I don't want to hurt you. Okay. All right, and I'm also looking for guarding. Is he guarding? He's, you know, that's something I'm watching for too, but you're not. You're not doing any guarding, so that's a good sign. Okay. And up here is your spleen area, over here is your liver, but we're just feeling in general. No tenderness here?
No.
Awesome. And I don't see any hernia around the belly button. Bladder, I'm going to gently press here. Any tenderness over your bladder area?
No.
Great. All right. Well, I think we're good for that part. So now I'm going to
Okay.
check your extremities. I'm going to check your legs and your arms. So I'm going to start with having you squeeze my hands.
Okay.
Okay. Thank you. And do you have any joint issues at all in your arms, shoulders, elbows?
I don't.
No joint issues, okay. So no pain or concerns with
No.
that, okay. And so I'm checking for circulation. I already checked pulses, that was good. I'm gonna check capillary refill. And I'm looking at nail beds to see if they're healthy. I don't see any lines on them. I don't see any discoloration. The cap refill time is great. It's like, 1 second basically. So you've got really healthy return of blood flow to your nails when I press them. I don't see any deformities of your knuckles, which is great. So I'm gonna have you close your eyes and I'm gonna see how your sensation is. I'm gonna have you tell me where I'm touching you, okay?
On my left arm, the shoulder.
Yeah.
Right forearm.
Mm-hmm.
Left knuckle, middle knuckles.
Yeah, hands works.
Hand. Back of my right arm,
Mhm.
tricep.
Mhm.
Right hand.
Awesome. Okay, so you got good sensation. You can open your eyes now. So you got great sensation. So I'm going to have you try to pull your hands up towards your shoulders, and I'm going to try to pull them the other direction. So you pull your hands up by your shoulders. I'm not there. Perfect. Awesome. Now I'm going to try to push your hands, and you resist me. Awesome. Okay. Great. Well, I think that's good. Let's check out your feet. When we're done, I'll have you roll to your backside, and we'll look at your skin on the backside, and we'll be doing good. So, alrighty. So, as I look at your legs, I'm noticing uniformity. I'm looking for skin color, and your skin color looks good. You have hair on your legs, which is a good sign that you have blood flow to encourage hair growth. That's good. So I'm going to check pulses. I'm going to check dorsalis pedis on both sides, make sure they're equal and strong. And they are. And you're young and healthy, so they're easy to feel. And then behind this bone here, your posterior tibial bone, I'm going to press there and make sure that I feel a strong pulsation and that they're equal, and they are. Like 2+, so that's great. And then like on your hands, I'm going to check for capillary refill and check the health of your nails, which your nail health is good and your cap refill is good. Great. All right, so we're gonna do the same thing where you close your eyes again. I'm gonna see how your sensation, how your feelings, how your nerves are. And, okay, so tell me where I'm touching you.
My left leg above the knee.
Mm-hmm.
Right leg by the shin.
Mm-hmm.
Motion. Right leg above the knee.
Mm-hmm.
Quadricep.
Mm-hmm.
Bottom of the left foot.
Mm-hmm.
Bottom of the right foot.
Mm-hmm.
Right pinky toe.
Mm-hmm.
And top of left foot.
Great.
On the toe.
Okay, awesome. You can open your eyes. I usually spend more time on the feet because that's where if people get some, whatever, I guess I don't need to talk about that right now.
Yeah.
More likely to see problems there.
Yeah.
All right, so your circulation looks good. We checked your nails. Any problems with your feet?
No.
Any problems walking?
No.
No, okay. No plantar fasciitis or pain in your arch or your heel here?
No.
You avoided that issue? Okay. Well, just like I did with your arms, I'm going to check for strength. So I'm going to push against your feet, and you try to push down that gas pedal, okay? Okay, push down the gas pedal for me. Awesome. Now opposite, try to push against my hands. Great. Okay, can you bend your knees for me, both of them? Great. Okay, so I'm going to push against you, and you try to straighten your legs out. Go ahead and straighten them all the way out if you can. Yeah, awesome. Okay, good. Okay, now opposite, I'm going to try to pull your legs, and you resist me.
Okay.
Awesome. Yeah, you're very, in your knees, I don't see any deformities in your knees, and you have full range of motion like most people do in your joints.
I do.
Great. All right, so I'll have you roll over if you could, please. I'm going to check your backside to make sure your skin's all healthy and there's nothing else that I should be addressing. Any rashes or anything that you've had on your skin or itching?
No.
No? Okay. So I'm looking for signs of skin breakdown, varicosities, any issues, especially I'm looking over like the bony prominences because that's where people have skin breakdown if they're going to have it when they're particularly, disabled or older, looking for on the feet to make sure the skin's all intact and no signs of breakdown or fungus or warts, all those fun skin things people get. So, okay, I think that looks great. You can roll back over on your back. I think we covered everything. I hope so. And so, is there anything that I can get for you, Tamsin, to make you more comfortable?
Could I just please have some reading material?
You
while I-
can. Yeah, a coworker of mine, Dorothy Hancock, thought she would enjoy this.
Oh,
So that's for
That's
you.
sweet.
And here's your call button.
Okay.
And can I have you go ahead and use it to make sure that it works? Yeah, it works perfectly. So if you
Alright.
need any help, make sure to use this call button.
Okay.
If you can't find a call button, use your voice box to holler for us, okay? But hopefully this is always
Sounds
right
great.
near you. And I'm gonna lower the bed so we're safe.
All right.
And what else can I get for you? Anything else?
I guess just some crayons or colored pencils
Okay.
for my reading material.
Okay.
Great.
We'll get that. Well,
Thanks,
it's very
Diane.
nice to meet you. I'm gonna go see what your orders are to help take care of you and get you better. So,
Okay.
thank you so much.
Thanks, Diane.
I wash my hands because I'm leaving the room.